So today in this video, I'm going to show you how to evaluate a small kid from age range 2 years to 10 years or whatever, young kid basically, how to evaluate the patient having unilateral nasal discharge. Okay, so this is a case I got a patient referred from a different doctor. This kid is 4 years old and he had symptoms of unilateral left-sided nasal discharge since around 3 to 4 days. He had severe pain while touching on the nose. He wouldn't let any of his parents to touch his nose, so he would cry immediately. So there was severe pain. So there's tenderness on touch, first point, unilateral left-sided nasal discharge. Now the discharge was somewhat around sticky, mucopurulent, gradually converting itself into mucopurulent. It was initially just transparent, and then it was sticky mucoid, and then it became mucopurulent, and then it was somewhat very very whitish. So the parents of the patient took him to a different doctor first time, and the doctor got a CT scan done, and on the CT scan it was evident that there's a particular mass in the left side. But how to evaluate this now on the CT scan basis? Now today every doctor, if they see a patient out there having something in the nose, they get a CT scan done. Just get a CT scan done. I don't know what's the reason for that. So I got the CT scan, but also I'll tell you the advantages of getting a CT scan done at least. Okay, so the patient may have a unilateral a tumor mass, gradually progressive. Even though in kids we get tumors, it could be a foreign body lodged. Now this patient had a sudden discharge since 3 to 4 days, pain, tenderness, but we do not know what the condition is. So we got the CT scan was done, and as you can see the CT scan, I'm going to explain you. You can see some soft tissue shadow over here. Just follow the cursor right here, and I'm just gonna show you the CT scan from the very start. So this is a 4-year-old kid. You cannot see any frontal sinus right here. Okay, so we all know frontal sinus is absent at birth. All the sinuses are present at birth except the frontal sinus. So you will not be able to see the patient's frontal sinus anywhere because he is just 4 years old, and the frontal sinus starts to begin at around 2 years of age, and radiographically it can be only picked up on a CT scan or an X-ray at 6 years of age roughly, not before that roughly. So he's a 4-year-old kid, so definitely you can see the frontal sinuses are absent. So as we go behind in the very initial part, you can see the left side, you can see the complete opacification of the left side. Okay, and you can see the complete opacification on the left side, but you can see some same iso intense shadow of the soft tissue, but on the left side you can see some bright, as compared, a hyper intense shadow is quite visible. So this is a nasal septum, that's the soft tissue opacification over here. But you can see, let me just zoom this, it will be much better. You can appreciate the faint hyper intensity. Now I'll just focus this. You can see over here there is a slight hyper intense, not as hyper intense to the bone, but still as compared to the soft tissue in the nose, you can see this is some hyper intensity right here, and that hyper intensity keeps on continuing behind, keeps getting bigger, so it appears to be as bright white. So it could be either something to do with calcification, or some kind of a stone inside, or some kind of a bone inside. So it could be a benign tumor, it could be anything in terms of a osteoma, or you can say it could be a foreign body lodged inside. It could be a something which is hyper intense, similar to bone, okay, or having calcium in that. And you can see that it is getting bigger and bigger. You can see some hyper intense soft tissue. You keep on going behind, you can see the appearance of the maxilla over here, and you can still see there is evidence of the soft tissue completely opacifying the left side. Now you can see that something is here, so you can have an idea that it could be something that is hyper intense and similar to the bone or calcium. So you can also have a differential diagnosis initially that it could be a meningocele, meningoencephalocele, or any unilateral differential diagnosis. We have a huge list of unilateral nasal masses. but this is something different, and if we keep on going behind, it just disappears. Okay, so I'm going to show you the different sections as well, and I'm going to show you the axial. So you can see in the axial section, you can see that is a huge hyper intense. You can see a flaring up of the area over here, and the same thing you can see a oval or elliptical shape hyper intense area. So we spoke to the radiologist, we got it confirmed, and it came to be as a foreign body, something to do with a hyper intense shadow with a lot of granulation tissue surrounding it. So the patient's parents were not even aware of anything like this. They had no idea that the patient was having something inside his nose up there. So just because he had discharge, pain, foul smelling discharge a little bit, and what do you say, the mucopurulent thing, because of that we came to know that he has something inside. So I'm going to show you the surgical video, and I'm going to show you how huge that was inside the patient's left nasal cavity. So that is why the CT scan is really important to rule out what exactly is going on inside, because he's a small kid. He's not going to allow any doctor to see his nose. So I was thinking that I'll just do a suction before I come up to any conclusion, but the patient did not allow me to do anything, so I had to take the patient under general anesthesia, because we cannot take this patient with brutal force and hold him down, hold his hands or legs or head, and just put a instrument blindly inside. We cannot do anything like that, especially in private practice on human concerns ground. Okay, so we have to take the patient for fitness and under short GA, and we can remove that within 2 or 3 minutes safely without any bleeding, and a proper examination can be done only if the patient is under GA. Okay, it's a short GA. So I'm not going to shift on to the surgical video right now. So as you can see, the patient is a small kid. He's 4 years old. He's under short GA. Short GA in which you do not intubate the patient. It's just under the effect of anesthesia, where we inject anesthetic drugs. So I'm going to check the patient in the right nasal cavity to look for any other abnormal, suspicious lesion. What I can see is just somewhat of mucus secretion, a normal nasal cavity. This is the patient's left side. You can see a lot of mucopurulent secretions. We can already see there. That's thick mucopurulent secretion. I can actually see a mass behind. So the patient wouldn't even allow to have the suction done. So I'm going to go on the patient's right side just to evaluate. You can see some mucopurulent secretion happening and flowing from the superior region, sphenoethmoid recess into the posterior choana. So this patient could be having some sort of sinusitis already happening. You can see a lot of mucoid secretion. So this is basically thick mucoid secretion, and what you can see over here is the thick mucopurulent secretion. So I'm going to suction now, and I'm going to see what is behind that mucopurulent collection. So as you can see, it's thick, tenacious secretions, and I can see something, a lesion, which is huge, some kind of thick deposition over that. It looks mostly like a seed, which was lodged. Looks kind of very old, and you can see a lot of granulation, calcification happening around the surface, and it is kind of very huge and causing compression on the mucosa of the lateral wall as well as the septum. You can see a lot of surface deposition. This could be definitely some kind of infection also happening on the surface. That's definitely a seed. Looks like a seed which has swollen up. So So as you can see, the patient is under short GA. We do not intubate the patient. So hence also we do not put any throat pack. So there's one reminder for all of you out there. Do not use a forceps in this situation, because that's just going to make it worse. Take a ball probe, go behind, underneath, and pull it towards you with gentle pressure. It's going to easily come out. Do not use a sharp artery forceps. Remember that. So you can see it's coming out very slowly. You're going to take it out. You can see all the secretions coming out from there. So imagine if you had removed this when the patient was still conscious, not under any effective anesthesia. Imagine the amount of bleeding that would have happened with the patient moving here and there. So you just got to be careful. Remove this under GA, short GA. Take some fitness, and this is always the safest method. But when we were residents, we always used to do it under, you know, pressure, under force, with the patient being under conscious alertness. So you can see a lot of pus, mucopurulent secretion up there. The size of this seed is huge as compared to the opening of the nasal cavity. So once you remove that foreign body, you gotta go inside again, and you gotta look for any injury. As you can see, a little bit of mucosal damage is present on both the sides. Uh, you can use xylometazoline nasal drops to stop the bleeding, or you can just put a small ab gel over there soaked in Lox 4% solution. You can see all that calcification and granulation has taken place on the lateral wall as well, the mucosa of the lateral wall. But I'm not going to do anything. I'm going to just allow it to heal. Sometimes you can also use a Lox 10% spray, as you can see I'm going to do right now, because that's once I spray that inside, it's going to make sure that there is no bleeding anymore. This also tends to cause stoppage in the bleeding. And you can also apply antibiotic solution or antibiotic ointment and keep a very small dissolvable pack inside. But we do not do any of that, because if the patient after coming back to consciousness can accidentally inhale that and can aspirate that piece of abgel, so we do not do that. You can just apply an ointment over the mucosa wall and start him on nasal drops for 3 to 5 days. That's it, with steam and avoiding the cold stuff later on. So also one more thing, do not give a nasal wash. Sometimes people may think of giving a nasal wash with normal saline or Ringer's lactate. Do not do that, because the patient is not having a throat pack and is under just short GA, okay? So the patient may aspirate. The patient is breathing right now, okay? The patient is breathing. He's just under the effect of anesthesia, but the patient is breathing for sure. So do not uh, do a wash. So this is how I tried to evaluate this patient and eventually remove that the foreign body. And once the patient is in conscious state, we can call him for a follow-up maybe after a week or so. You can see the amount of damage the foreign body has caused inside. This is that oxymetazoline spray, which is going to cause hemostasis for a while, and then there won't be any active bleed as such happening. So that is all what you can do, and short GA hardly works for roughly 15 to 20 minutes, max to max half an hour. So make sure you do whatever you do it within that span of time. So this is all going to heal on its own. A new layer of skin is going to take its place. Always make sure you go up to the corner and check for any secondary foreign body behind. Okay, you can see this patient is having a severe turbinate hypertrophy, inflammation, congestion, which is going to gradually resolve as the foreign body is out now.